Welcome, everyone. I'm Dennis Stone, Director of the Center for Advocacy and Social Justice at the Jacksonville Urban League. We want to welcome all of you to this town hall. This evening, we will be delving into the subject of resources for youth in terms of mental health. And to start us off, we have Audrey Gephardt, an intern at the Urban League. Also participating are Lexi Potter, Daniela Rodriguez, Zoe Samuels, Juliet Winter, Sasha Wilson, and I think that's it for, unless Audrey has another one to add. I want to welcome all of those interns have made this possible, and this is being recorded so that it can be used by other audiences in the future. So with that, I will turn it over to Aubrey.
Thank you, Dennis. I just want to give a big shout out to everyone who worked together on this PowerPoint, all the interns. We spent a lot of time on this, and hopefully if we can just reach some people who can use this and find it useful. So we actually have a PowerPoint that we're going to pull up, and then we'll get started. Awesome. So today we are focusing on how to look after our mental health. This town hall is going to be resources for high school and college age youth. So today we're going to have an introduction from each of our interns, and then we're going to hand it over to Juliet to have her presentation, and then we're just going to finish off with some resources. So I'll go first. My name is Aubrey Gerhardt, and I'm currently a junior criminal justice major here at Stevenson University in Maryland. But I'm so excited to be able to do my part in public service here at the Jacksonville Urban League. This is my first semester as an intern, but I feel like I've already done so much, and it's really exciting to be here. So I'll turn it over to Lexi.
Hi, I'm the one manning our PowerPoint today. I've been super excited to help with this town hall, and I'm excited for some of the other ones we're working on currently. I'm a senior political science major at Florida Southern College.
Hi, everyone. My name is Daniela. I am this is my first semester here at the Urban League. I am a third year at UNF, majoring in criminal justice, double minoring in Spanish and psychology. I want to thank everyone for coming, and hopefully you could find these resources useful for yourself or for someone that you may know, and I'll pass it off to Juliet.
So hi folks, my name is Juliet Winter. I'm a senior in my last semester at the University of Tampa, but this is my first semester with the Urban League. I'm very much enjoying it so far. So do I just go into the presentation then, or is there like another way to do this?
So I think, is this our last slide before the presentation? Lexi, okay, perfect. So yeah, Juliet is now going to share her screen and do her presentation on deaths of despair. This is super interesting, so we're really excited for this.
Okay, awesome. So the deaths of despair is something I've been studying very closely for the last couple of months. I did an independent research project on it with one of my faculty, so I really love it, and I just think it's super important to know. So let's talk about the deaths of despair, as Aubrey pointed out. So just a few table of content. what is it? What are the deaths of despair? We're going to be jumping into just kind of the definition. Who does it affect? Its impact, and how do we stop it? So some warning signs, prevention, and understanding, just so it doesn't affect your community as strongly as it has affected other communities. So number one, what is it? So the deaths of despair, it's technically described as due to suicide, drug overdose, or excessive alcohol use, and that's sourced from the Center for Disease Control. But the term deaths of despair itself was actually coined by Ann Case and Angus Deaton in their book, which I'm going to go further into in the next slide. So just here's a quick quote from Ann Case, who wrote the book I mentioned earlier. In today's news, we talk about what a tragedy it would be if 200,000 people died of COVID-19. Deaths of despair are in the same ballpark. The difference is that we expect those deaths will continue after this crisis is over. So moving on, who is it affecting? So Americans across all social classes, genders, races, and religions are impacted by this, but deaths of despair has been increasingly specifically for low-income Americans, Americans with lower degrees of education, white Americans, American men, specifically between the ages of 18 and 45, and it's a lot of times in rural areas, urban areas, places where help isn't as readily accessible. This was the book I mentioned earlier by Ann Case and Angus Deaton, Deaths of Despair and the Future of Capitalism. It's a great read. I'm not big into reading, but like I love this book, so I highly recommend everyone read it. So let's just get into a quick history of the deaths of despair. So economist Ann Case and Angus Deaton coined the term deaths of despair, as I mentioned earlier, but it's actually based off a much earlier concept coined by Emile Durkheim, a sociologist, known as anomic suicide or alienated suicide. So what this means is that these deaths were caused by a lack of integration within their community or a lack of communal spirit. And also the conclusion that the government is indifferent to the needs of society, meaning a lot of people don't believe their struggles will ever get better because the government just doesn't care enough about it. So it's just a lot of lack of hope, lack of communal spirit, stuff like that. And I sourced that from Stat News, which is a great article if anyone's interested. So what causes the deaths of despair? Mainly economic factors, weakening social structures, and loss of meaning. So when I get into economic factors, this could be deteriorating labor markets as we're seeing right now with the COVID-19 pandemic, educational attainment, less people are going to college, that kind of situation, weakening social structures, so marriage, churches, friendships, labor unions, all that kind of stuff. And just a general loss of meaning in life. So we're talking about religion, family, love, work, etc. Think of divorce, losing contact with your children. All of this plays a huge role in deaths of despair. So I wanted to jump into how it's a problem mainly facing white American men. And in their book, Ann Case and Angus Deaton note that these deaths disproportionately occurred in white men who had not earned a college degree yet. So a lot of these men only have high school education. Sometimes they don't even have that. So as we see in this graph, between 2000 and 2022, the mortality rate for working class white men without a college degree skyrocketed 25%. And the main cause of these deaths is because of situations like this. Oops, sorry, is there still an echo? I just saw that chat.
Maybe try muting yourself and then unmuting it. I'm not really sure. It only started when you were doing your presentation.
Okay, any difference?
No, we can still understand you. It is just echoing a little bit.
Oh, I'm sorry, I don't know what the problem is. All right, well, I'll just keep going, but maybe I'll try to be like a little louder if that works. So, moving on. Where are deaths of despair most prominent? As I mentioned earlier in my presentation, they're most prominent in more urban or rural areas where there's not a lot of things going on, not a lot of help available. But if we're talking about specifics, drug and alcohol abuse is actually most prevalent in the Northeast, while suicide and alcohol poisoning is most prevalent in the West. And if you see this chart right here, you'll see the rates of each of these types of situations in each part of the country. And as you see, this like Midwest area right here, I don't know if you see my mouse, it's all red. that's like because they have the highest rates of deaths of despair. So something to really take into consideration when I say rural, I mean like rural. So you don't see it as much in California. I mean, it's definitely like pretty widespread on like the East Coast, but definitely not nearly as bad as Midwest. So something to think about. So as I mentioned before, the contributing factors were economics, lack of education, and lack of social integration. And so I just wanted to point out some warning signs, suicide, just in case anyone you love is experiencing this. So the very obvious one is that they're talking about wanting to die or wanting to end their own life. They're looking for ways to do this, talking about feeling hopeless or having no purpose, talking about feeling trapped or in unbearable pain, talking about being a burden to others, increasing the use of alcohol or drugs, sleeping too little or too much, withdrawing or feeling isolated, showing rage, talking about seeking revenge, and displaying extreme mood swings. As a college student, a lot of my friends have, oh, I just got another message, I'm sorry, I'm like missing all of these messages. Okay, hold on, let me go to settings. Okay, you know what, just moving on, because I cannot figure this out. So as a college student, a lot of these signs I see in other college students, just because everyone's really stressed out. So this is really important to look out for people, because some of them just like pass themselves as like a joke, or like, oh, I was just saying something because I was stressed. But like, it's really important to really take these threats seriously, because a lot of times the people you least expect to do it are the ones who end up doing it, and it's really tragic. So moving on to warning signs of drug and alcohol abuse. And this slide actually really hits home for me, because I did lose a cousin to the deaths of despair. He grew up in rural Maryland, where there wasn't a lot going on, and he finished high school, but after that he really saw no purpose in college. No one really ever pushed him, so he did end up overdosing. Because there was really just nothing else to do. So this is a really personal topic for me, which is why I do so much research on it. So some warning signs with drug and alcohol abuse: risk taking when you're using, such as driving or having unprotected sex, neglecting responsibilities at school, work, or home, legal trouble. My cousin was in a lot of legal trouble right before he died, so that completely lines up. Bloodshot eyes, pupils larger or smaller than usual, changes in appetite, sleep patterns, physical appearance, unusual smells on breath, body, clothing, or impaired coordination. So if you smell alcohol, that could be a major warning sign. Drop in attendance and performance at work or school, engaging in secretive or suspicious behaviors, a sudden change in the friend group. They might be hanging out with a different group of people more that you don't really know about, or they haven't really talked about. Unexplained change in personality or attitude, mood swings, and they always appear fearful, anxious, or paranoid with no reason. So how do we stop it? Well, the key is research. Understanding the problem is the first key to solving this crisis. So that's why I wanted to really talk about this, because I feel like not a lot of people are aware of this problem, but it's actually one of like the top deaths among white men between 18 and 45 right now. I want to say number 2 is suicide. And I also want people to teach their community, inform your community, your kids, your family, your cousins, like watch out for your roommates, just everything. And then finally, prevention. So obviously, it's kind of impossible to stop this 100%, but knowing the warning signs is crucial to saving a lot of people. So whether or not you're part of this affected minority, seek help if you need it. Just like look out for your friends, talk to them, make sure everything is going okay, because this is a serious problem, and I really want to see it drastically decreasing within the next couple of years. Just some stats. Since 1991 or 1999, 841,000 people have died of a drug overdose, 95,000 people die from alcohol-related deaths annually, and 1 million deaths worldwide from suicide. If you're looking for help, or anyone you know looking for help, just remember that there's help out there. The suicide hotline, I've linked it here, and substance abuse hotline are both great resources if you just want to talk to someone anonymously about it. And yeah, so here are my sources, and I hope this was very informative to all of you. Sorry for the technical difficulties.
Great, thank you so much, Juliet. So now we're going to open the floor for anyone to share their experiences, or if you have any questions for Juliet after that wonderful presentation.
I see we have Richmond Wynn in our audience. I can't help but ask you that question. Richmond, any comments on the experiences that Juliet was sharing?
Yes. So, excuse me. Good evening. I'm Richmond Wynn. I am at the Vice President and Chief Diversity Officer for the University of North Florida, and I'm a licensed mental health counselor as well as a certified addiction professional. And very good presentation. I mean, you really, Juliet captured a comprehensive profile of what we know to be who is most affected by the deaths of despair, and then who's most affected. You know, I certainly recognize these signs and symptoms from my mental health training and work over the years with mental health and in substance use. And just a couple of things stand out. One is that alcohol-related deaths are usually unintentional, right? Certainly people can use alcohol if they are intending to kill themselves. That's usually not the method, particularly for the population that we're talking about. So some of the ways that happens is, you know, obviously alcohol and overdose. That's beyond regular intoxication, if you will, but it's really consuming in large amounts of alcohol in a short period of time where your body doesn't have a chance to process it. Mixing alcohol and other substances, particularly prescription medication, will do what we call you'll have a potentiation effect. So whereas usually 1 + 1 = 2, but when you mix, say, alcohol with Xanax, you have 1 + 1 = 4. And then the other things that happen with alcohol in particular is obviously super impaired in decision making. So people, you know, drive after being intoxicated and may cause death in themselves or someone else. And then extreme risk taking. So I think so some of those are warning signs or risk factors, if you will. And if you are in relationship with people who may have a relationship with alcohol that is excessive, and you see this behavior, the risk-taking, the really impaired decision-making, that's part of that, just part of those warning signs that they could be, you know, someone who might be in this group of people that we are looking at and talking about deaths of despair. Going back to the slide that you had with research. I'm sorry, Sasha has your hand. Sasha, you have your hand up.
Yes, I have a question about something you said about the warning signs.
Mm-hmm.
When you're trained on noticing the warning signs, is it more so surface level training, or are you given in-depth research and resources to be able to say, hey, this person has a problem?
Well, and so it depends on, you know, who's doing what the training is, who the training is for, and you know, the purpose of the training. So as a mental health counselor, obviously we are, as part of our academic training, we are giving quite a bit of training in assessment, diagnosis. And so there's a lot of information that we have for people who are not trained mental health professionals. You know, you might have heard of mental health first aid or psychological first aid, that kind of training where people who are not mental health professionals are provided training on recognizing signs and symptoms of depression, anxiety, substance use. The intent is not to equip you with enough information to perform a full-scale psychological assessment and diagnosis. It is meant to equip you with enough information to be supportive of people that you're in relationship with, and to help get them to the right resource, like to a counselor or a hospital emergency room. But it's to help all of us, we might call lay people in that sense, to equip you with enough information so that you can at least recognize that something is off here. Something is not right, and this person could benefit from talking with a professional or a professional intervention. So it depends on what kind of training you get. If you are participating in like mental health first aid, then you're not gonna get enough information to be able to assess and diagnose, but enough to intervene and to be helpful and supportive and hopefully connect the person to appropriate resources.
Okay.
Mm-hmm. I was going to comment on the slide, Julia, that you had on the research, teaching and prevention, and I added in there, certainly as a counselor, I said counseling. But really, I started with personal growth and support. So not everyone goes to counseling for personal growth, and that's okay. I mean, I'm biased, obviously, but whatever resources people have for introspection, looking inward and seeing yourself clearly and more deeply. That's what I think counseling does, is it helps us see ourselves more clearly and more deeply. It helps us to uncover strengths and things about ourselves that are already there, but it helps us to remove some of the barriers to us seeing it. So whatever you do to do that, if you do that in counseling, that's great. Other people do that through support group, or perhaps in their faith communities, or through friendships that have where you're committed to helping each other self-reflect and see your growth needs. And so there's no one right way, but I think it's so critically important, because after having worked with people early in my career with substance use disorders, a lot of people say, oh, well, if you just stop, the just say no approach that we learned many years ago, that was not enough. It was helpful to get people's attention, but when you realize that there are other things going on that would enable someone to maintain a relationship with a substance that is having negative impacts in their lives, that is not just because of the makeup of the substance. It's not just because somebody might say, oh, that thing, cocaine, is so addictive. All you need is just one try and then you're hooked. Well, it's much more complicated than that. So what we've learned is that there are layers of issues, and many people have very traumatic experiences in their past, and they haven't been resolved, and they don't even make the connection between the trauma they've experienced and their way of coping through self-medication and using substances, or they don't make the connection between the trauma they've experienced and the suicidal ideation that they are managing over a period of time. They don't see the connection. So that's one of the benefits of counseling, is that we're looking at how does this puzzle of clients' lives fit together? How do these pieces come together? So that would be important. So that's the one thing I would add, just a little bit more to that. Your presentation there is that, something that helps us look at ourselves.
Okay, well, thank you so much. I appreciate that. And I will definitely add that for the future.
Thank you. I thought it was fabulous stuff.
Are there any other questions for Juliet? You could either unmute and ask, or send them in the chat and we'll get them asked.
I do just have one observation or one question. It could go either way for Julia or for you, Mr. Nguyen. In this day and age, we are constantly surrounded by social media and, television shows and movies where substance abuse or those different coping mechanisms are very much highlighted and broadcast. And as adolescents and, college student age, as we are very impressionable, do you feel as though they have an influence, or are we at an age where we should know better and know, like, they're trying to show how, like, an addict goes through the stages, or we should know, like, we should not interact with those type of drugs or alcohol? Or do you think that we let those depictions easily influence us? Or
I'm gonna pass this one on to Mr. Wynn. I feel like he might have some better ideas because you work in a college, so you deal with college kids probably closer than I do. So
Well, if you have thoughts you can share, we can build on this together.
let me think about it for a
Okay.
little bit.
Okay, no
maybe
problem.
stick
No
with
pressure.
me. Okay.
No pressure. So I think certainly in any era of pop culture, so there was a time that social media didn't exist. Imagine that. We won't go down that road, Dennis. But and so there was something different though before, that we would say, the culture influence, and we would call it peer pressure, but it didn't come over the computer or on our phones. So yeah, there's certainly an element of that. Something else that goes into the scenario you painted is that there are many people who have experimented with substances and they have not had a negative impact. So that was one of the reasons why the whole Just Say No campaign, which was spearheaded by former First Lady Nancy Reagan decades ago, was initially, it caught on, but then people were like, wait a minute. It's bigger than that. It's stronger than that. I can't just say no and that be the end of it, because remember, it's how these pieces of our lives fit together. And so if we're not looking at some of these more underlying issues, just saying no is not going to cut it. And then if you're not looking at the underlying issues, you're trying to say no and you haven't, and you've had experiences where you engaged with any of these substances and it wasn't bad and it worked for whatever you wanted it for, then you have a different frame of reference. Because along the time of the Just Say No campaign and the DARE program, some of you might have done that in school, is that like the DARE program in particular did a lot of scare tactics that we used to call them. Like, if you do this, this is your brain and this is your brain on drugs. You've seen those. If you haven't seen those commercials from years ago, go to YouTube and Google and search for your anti-drug commercials or something like that. And they are really dramatic. Well, what happened was, certainly we had kids in schools participating in these programs, and Just Say No was popular, and DARE programs, police officers would come and deliver the program. So you had this authority figure telling people of how horrible their lives were going to be if they use any of these substances. When in fact, people as young as the third grade, because I have done some of those presentations a long time ago when I first got into the field. And number one, kids as young as the third grade could recognize certain substances, whether it's because their parents were involved, or they had siblings or other people were involved. They knew, we had pictures and things and we would show them. But the other thing is that kids and young people and older people alike have had experiences where they use substances and it didn't ruin their lives. They didn't have all these negative impacts. So they dismissed those messages and so those messages became ineffective. And so then a moratorium on all those prevention efforts were called and says, we need to rethink this. So let's stop what we're doing and let's go back to the drawing board. So you have, is it Daniela? You have people's experiences that were positive or functional. It worked for them. It helped maybe to release stress and there were no negative consequences. You have unresolved issues or just simply developmental issues that we all have. And then you introduce mood and mind altering substances in that process, and it helps you, kind of navigate life. So again, more sort of positive things. And then you have this social pressure, even passive, what we might consider passive, where say on social media, people are not targeting you directly to say, do this, but they're celebrating. How many pictures do you see and people are enjoying themselves and they're imbibing in some way, shape, form, or fashion. And while they may not present it as a celebration, it could come, as a celebration of their relationship with the substance, it could come across that way. Then you may have people who are actually outright celebrating substance misuse and substance abuse. And so that can influence us. If we think about substance use problems as a combination of the biological issues. Maybe there's, sort of brain chemistry issues, sociological, what's going on in your environment that might predispose you to having more complicated relationship with substances of abuse, or that may be actual problems like low income, domestic violence, and violence in other areas of your community, or neglect and abandonment. I think of even the people who are not coming from low income homes, they also can experience abandonment because maybe their parents are high powered earners and they're not home. And they, that kind of thing. So there's gaps there. But when you have all those sociological issues, there are psychological, did I mention that? Psychological concerns, there are spiritual concerns, and then, the actual makeup of the substance itself and what it does to your body. So all of those things we want to look at, what's going on in all those areas of your life and what might make it easier or more attractive for you to develop the kind of relationship with mood and mind altering substances that could be difficult or problematic. And on the other end, like the prevention that Juliet talked about, what are the protective factors? So you're going to look at what are the risk factors, and then what could set you up for problems, and then what are the protective factors? What can insulate you from the problems, even if you are exposed to all those things I mentioned and to the substances? What are the things that you do have in place that can protect you, even if all those things are also true? So it's a multifaceted is where I'm going with this. It is not just social media, but yes, I think pop culture, current culture, social media, it's a direct link. It's direct advertising in many ways. And I think, as many controls as we think we can have on social media, I think young people in particular, can always find a way to be exposed.
Yeah, just like I had this thought while you were talking. So I'm thinking you might be relating or like referring to Euphoria, which is like a pretty popular show among youth right now that really I feel like glorifies and depicts drug use. So as far as that goes, I don't really think there's any stopping that, unfortunately. But there is, with that, a lot of people on kind of the same page as you were, who are like, I don't know how I feel about this. Like, is this affecting our youth? Fortunately, I feel like Euphoria depicts the bad along with the good. So it's not only like, look how great it could be if we all just started like doing drugs. But yeah, in situations where it's like literally everywhere, I also fear for the more susceptible communities what's going to happen with that.
Mm-hmm. Exactly.
Yeah.
Look, I just saw a clip of you. It happened to be on. I was passing by, and it wasn't drugs that they were showing. I was like, "Whoa, wait a minute! What is this?" I haven't watched the full show yet, but I will check it out, I think.
Alrighty, if there aren't any more questions for Juliet, then we can pull up our PowerPoint about resources and actually diving in deeper to kind of what was just talked about a little bit, and then just how to reach out and when to reach out. So I think Lexi's pulling up the PowerPoint. Big shout out to Lexi for having Canva skills. So what we're going to discuss is, yes. Thank you, Daniela. So now we're going to discuss why mental health access is a concern, and when to go about it. Some self-care alternatives, because it can be so easy to turn to drugs, especially when you see it online, influenced by others, maybe peers, a little bit into peer pressure, like Richmond had mentioned. So some self-care alternatives and methods for improving mental health that you can take yourself, taking the initiative, and advocacy and resources. So I'm going to pass it to Zoe. Thank
Sorry. Hi, I'm Zoe. I am also an intern with the Jacksonville Urban League. This is my second semester with the Jacksonville Urban League. I am a graduate student, and I have my degree in criminology and a minor in legal studies from Drexel University in Pennsylvania. But I am currently in Jacksonville, just working. So to kick it off, it's why is mental health a concern and how significant is this issue? So 1 in 5 adults experience mental health concern within the past year. So this can include anything from uncontrolled anger to panic attacks, depression, or even body dysmorphia. And at least 2,889,000 adults in Florida alone have a mental health condition. And this can include anything from addiction, bipolar disorder, or even post-traumatic stress disorder. So another reason that, mental health is significant is due to the fact that mental health is integral. So when we are mentally healthy, we can realize our abilities, cope with stress, work productively, and contribute to society. I believe that this is a conversation that we've had more in the recent years and recent generations. And we can see this with small changes going about within our society. So a lot of companies nowadays will include mental health days as a part of a sick day or PTO days that they have set for the year for each employee. And they also have started to include wellness programs. So, these can be programs, health and wellness programs, but these can be programs to just create a work balance lifestyle through either gym memberships for physical health or even assistant programs for mental health.
Okay, so I shall continue to how do I maintain positive mental health? So we could go on to the next slide. So one of the ways that we can maintain like better mental health is through holistic healing. And this is basically in which it's a method of treatment that focuses on the person as a whole and not the specific condition. So for example, if you were struggling with anxiety or something, we're not gonna focus on like the condition of anxiety. We're gonna focus on everything about you as a person, like as I believe Mr. Richmond said, the sociological factors, physical, biological, psychological, etc. And so in this flyer, you can see just based on like the pandemic in 2020, how easily we were affected, our mental health was. So amongst adolescents ages 12 to 17, 1 in 6 individuals had a mental health issue or mental health concern. Also, in young adults, 18 to 25, 1 in every 3 had some form of mental concern, and 1 in every 10 had a serious mental health concern. And this number really racks up. As you can see, 3 million individuals have had thoughts of suicide, which is obviously very, very dangerous. If you reach to a point where you yourself feel like you cannot handle any more pain and you need to end your life, that is something very, very serious. So there's a lot more statistics on this flyer, but the most important thing is that from these statistics, we realize although there's so many individuals that have mental health, they cope in the most unhealthy ways using substances such as drugs and alcohol, which will not do anyone any good. It may just, it's more or less of a short-term relief because it takes your mind off it at that given moment. But in the long run, you're still going to have that mental health issue at the end of the day. So with holistic healing, we're looking at, we're looking at solutions that include therapy, medication, support systems, and so much more. We can go to the next slide. So a little bit more about holistic healing. This would include therapy, mind and body practices, medication, and natural products. So therapy could be like the standard one where you have communication with a therapist and you just voice out your opinions, your emotions. If basically when you feel like you can't talk to a friend or a family member, you just need to let it all out with a stranger or a mental health professional who has the tools to help you and guide you through those instances. There's also energy therapy where They use either electromagnetic energy, thermal energy, or ultrasonic energy to heal the body by energizing your cells and help you flow that energy through. So in this case, if you are struggling with depression, anxiety, you feel overwhelmed, you would use energy therapy to kind of like reduce anxiety and pain by helping it like flow through your body, so to speak. Also, you have body-based therapy, which is basically yoga. You can go to a chiropractor because, when we tense up, our bones in our body, they feel knotted and stuff. So when you go to a chiropractor or get a massage, it's meant to relieve that tension and it's meant to help you both physically and mentally. Because I feel like when you physically feel better, you can sometimes mentally feel better. So mind and body practices, this would include yoga, meditation, relaxation techniques, breathing techniques. It could be anything as taking a deep breath, just holding it in, think about it, taking a pause, and then really looking the task or whatever you're doing as a whole. And then medication, this would be, antidepressants, things of that nature to kind of help you cope and help your hormone levels. And some of the benefits from holistic healing, some of the physical ones are that you have relief from pain, fatigue, you have more energy. It improves your sleep, your digestive, and your immune system. Some psychological benefits is that it reduces your mental fatigue and increases your concentration. So you have more focus, you feel more motivated, and things of that nature. You're fine, Lexi. And then some of the emotional benefits are that you have less anxiety, less stress, and you have more balanced emotions. We can go to the next slide. And so these right here are two resources that I found amongst Duval County Public Schools. And I did not know these existed, full service school programs. So some schools, mainly in elementary schools, which I found very interesting, are full service school programs in which they connect students and families with services such as like therapists and any health and social services that they may need. So this would include behavioral help. So if you have a child who does not listen well, does not take any direction, you could reach out to a behavioral therapist, for example. Individual family counseling, this can include from helping deal with like the loss of a family member, your parents going through a divorce, or you're witnessing some domestic abuse, or it could be anything minuscule of like just lack of communication from parent to child. You can have counseling for that. Mentoring, this would be more, so to speak, like a buddy system, help students connect with other students in their school, or maybe like it could be like a big brother, big sister program where you have someone there for you. And then medical health services, if you can't afford like insurance or things of that nature, they will help you find the resources that you need. And then another resource that I found that was very interesting, because I know we are in this era where there's like an influx of podcasts. I know I've been listening to a couple podcasts. So this one is student-led and student-produced. It's called On Our Minds with Noah and Zion. It is hosted by two teen reporters who basically like share stories from high schoolers and things that they're going through. It could be anything from stressing out over grades. It could be anything from COVID. It could also include stuff that doesn't deal with school related. It could deal with bullying. It could deal with grief. And it will share the perspective from an adolescent teenager. And you can listen to this podcast on Apple Podcasts, Spotify, Stitcher, and RSS. If anyone is interested, I do have the links for them and I will link them in the chat. And yeah, I can pass it off to Sasha, who will talk about the legislation.
Hi, everyone. My name is Sasha. I'm a graduate student at UCF, dual mastering in public administration and criminal justice. So yeah. I'm also happy to be sharing the different legislation and programs offered and supported by the community, the Jacksonville community. The first one is the Mental Health Parity and Addiction Act. This act is a federal law requiring group health care plans to offer mental health and/or substance abuse benefits on par with the medical and surgical benefits offered. So this is just a program where if someone is in need of medical assistance, they're able to receive it. So for example, this also falls in line with the Baker Act. So if you see someone and you're concerned for them, this is where they're being able to be held for about 72 hours. Then there's other different treatments they can receive depending on the medical concern at the time. Also in Jacksonville, what was interesting for me was the Jacksonville Mental Offender Program. This is a local program in Jacksonville that has started about a year ago, designed to reduce the number of people suffering with mental illnesses cycling in and out of the Duval County Jail on misdemeanor charges, most of which stem from homelessness. Now, this is interesting because homelessness is one of the biggest pandemics in the state of Florida alone, with a bunch of people being homeless and all counties going out throughout the state. So this is really good that it helps them. If it's like a minor offense, if they're fighting because they're out of their mind, they're given the assistance they're needed rather than treated like a criminal, which is good because it shows support for the community rather than beating them down and putting them back in a cell where they can possibly not receive the proper treatment they need. And then on the next slide, we have more legislation and programs such as the Florida Mental Health Advocacy Coalition. This is a nonprofit, nonpartisan coalition of organizations that advocate for policy changes to improve the quality of those who live with mental illnesses and substance abuse disorders. So for the state of Florida, this is just a bunch of groups and basically lobbyists who go and speak on behalf of those suffering from mental health. There's also testimonials that come from those suffering with mental health, so they can explain how they would prefer to be treated and what actually works for them, as well as, doctors and scientists giving their input as well, so that there's more progress in this field. There's also the Child Guidance Center of Jacksonville, where children and adolescents are able to go and seek treatment. The mission of the Child Guidance Center of Jacksonville is to provide high-quality mental health services for Jacksonville families. There's a full range of comprehensive services to support the community to help reach their unlimited potential, whether it's academics, job professionalism, and things of that sort. So it's not just for adults, it's for children and teens, mostly from elementary school to high school. Also, they give the counseling and support offered, as well as they give the resources or provide resources for additional treatment. I can also share their websites for the Jacksonville Mental Health Offender Program and the Child Guidance Center in the chat for if you want to use it as an additional source or recommend it for those who need it. I think this will be very good for schools in the area, being that they don't always have the resources and guidance counselors are not always equipped with the right advice to give children, or they don't always have all the tools. So I think these 4 programs and legislations are important and could be used.
I almost started talking without muting my mic, or unmuting. Hi, everyone. As I introduced myself in the beginning, my name is Lexi. I just want to take some time to thank everyone for, listening to our team. This is the first town hall for a lot of us interns that we're hosting. So we appreciate everyone being so interactive and listening. So Aubrey thought it would be a good idea to, reinforce, after giving out all this information, what's something all of us can do, because we go over some policy initiatives, but also there's things that we can all do in our daily lives and implement in our practices. So in order to reject the stigma about mental health issues, because, as we know, with a lot of the different avenues of mental health struggles that we've talked about, a lot of issues that people face are stigma, you know what I mean? A lot of us college kids, deal with mental health struggles ourselves, and we don't reach out to people because, it might feel embarrassing. There might be stigma about like, oh, I don't want people to have these preconceived notions about me due to me identifying with this mental health condition or being diagnosed. So, in order to reject the stigma, reinforcing hiding it does not make it disappear. No matter how much you ignore your problems, they're not going to disappear. And I know in some of my own personal experiences, dealing with mental health issues is hard work. I've done some counseling. It's hard. It's doing the hard work to be confronting those issues. Props to a lot of people that do counseling because it's not easy. And then I also want to reinforce here, challenging the stigma takes understanding, it takes education, like what we're doing here. And it takes a closer look at our own attitudes towards health and our own biases. So we have to be willing to unpack our own biases in order to break free of, potentially currently harmful standards of being. So just make sure, if you find yourself being judgmental of yourself or others, check yourself and take a moment to reflect on that, and it helps you build on changing those thought processes and those biases. So that's really important for mental health work, for our own mental health struggles, dealing with our friends, coworkers, anyone, having empathy. You have to unpack those biases that you have, when it comes to mental health as well. So that's our little our little rundown on rejecting the stigma. This is so that's pretty much most of our presentation. Thank you. We're gonna be giving out a toolkit that we've been putting together. We're finalizing it. It's going to do some of the same things we did here today. It's going to run down on some of the information. It's going to provide some examples and resources, and it's also going to have a little checklist or questionnaire on there. So keep an eye out for that. I think Aubrey or Daniela have a Google form to fill out if you're interested in the toolkit. If I'm correct.
Yep, thank you. Thank you, Lexi. I'm going to put the toolkit in the chat at the very end so that you guys can just click on it and fill out a few questions. And then we'll be sending out our resources afterwards. Thank you, Lexi, again for managing the presentation. So before we open it up for questions, I just really wanted to highlight, definitely if you take one thing, it's to reject the stigma. Really the first step is getting this help for yourself and making that step to look for the resources. And like Daniela said, the physical part is just as important as the mental part. So people don't normally think that like the mind and body are that much like connected, and really it's like been proven. All my psychological folks out there, my psychology classes have taught that like depression can be rooted in physical aspects. So, if you say don't get enough sleep, or you have other physical aspects like not eating enough, or anything like that, it can lead to other problems as well. So that was great in just highlighting the connection between the mind and the body and how powerful the mind is. So people don't realize, their thoughts can be detrimental, especially if they're in the negative, and then you just get caught in that process and you fall into a hole and you're not sure how to get yourself out. I feel like really highlighting this and just hopefully our presentation helped. And if you do find any of this information useful, Richmond, if you want to step in with the psychological part of that, it's very important.
Thank you. Wow. You all put a lot of work into this. I will highlight a couple of things. One is just a few more resources. The Youth Crisis Center, which is very helpful for young people who might be experiencing homelessness, or might have left their homes for a reason, and they can get counseling there. Hope Haven is a private hospital setting for young people. And Gateway Community Services still has programs for youth, as well as River Point, which is another private hospital. Deborah mentioned Northwest Behavioral Services is a resource. And then I wanted to mention Jasmine, and that's the Jacksonville Area Sexual Minority Youth Network for LGBTQ plus youth. And they have done a lot of work they have counselors there, and they have done a lot of work, many years developing GSAs, Gay Straight Alliances in schools. They work with Equality Florida. And that identifying as LGBTQ plus is a risk factor in and of itself, particularly if you think about the Don't Say Gay bill that is currently making its way through the Florida legislature, challenges that a lot of young LGBTQ youth have at home. And so now their parents are being, for some, their parents are unfortunately part of the problem. And so that bill is certainly putting them further at risk if teachers can't be a resource person for them. And so certainly we've heard of the high incidence of suicide among LGBTQ plus youth, not to mention the substance use and other mental health challenges that those youth face. I wanted to touch on a couple of things and then I'll be quiet. One is a couple of other things, I should say. And one is the mental health continuum. When we're very accustomed to referring to mental health challenges as just simply mental health. Well, in fact, we all have some kind of mental health. And if you think about it on a continuum, on this end might be mental health with no complications, or good mental health, if you will. Things are flowing in your life, you're functioning well, you have clarity, you're making good decisions, but that still means there is some mental functioning going on. It's just that it's uncomplicated and there are no problems associated with it. And then if we skip all the way over on the other end of the continuum, we would see disorder, diagnoses, the diagnostic and statistical manual, the problems that we're talking about, the depression, the anxiety to that degree, suicide, certainly all the disorders that were mentioned before, and then some. And then all that space in between. And we have the ability to move along that continuum, whether we're using resources to help us do that or not, we're all on that continuum somewhere. And sometimes there are situational things that happen to where it moves us out of that functional mental health to a more temporary, complicated state, not quite at the disorder stage, but your mental health may be compromised by a situation. You think of loss, grief, trauma, or good things that happen. You get a job, you get an internship at the Jacksonville Urban League, and you complete that internship and you graduate from, is everybody doing like multiple programs like Sasha? Are y'all doing, you all are dedicated students and I really appreciate that. So that's a good thing. And students, being a student comes, that comes with a little bit or a lot of stress. So graduating from school, that actually can impact you in good ways and sometimes not so good ways, even when good things happen to us. So think about mental health as on a continuum, and think about where you are today in terms of your mental health. And then where do you want to be? Do you want to be somewhere else on the continuum? And what kind of resources might you use to get you there? I like to think of it, as someone mentioned, the parity, you were talking, maybe it was Sasha again, you're talking about the parity between physical health, mental health. And we tend to, when I say the word hygiene, what comes to mind? We tend to think of physical, right? Well, think of mental hygiene. And if you think of your physical hygiene, most people think, okay, this is what I do. You don't have to give me any details, but what I do on a regular basis to attend to my physical hygiene. Well, what do you do on a regular basis to attend to your mental hygiene? How do you brush your brain to challenge some of the negative thinking or tunnel vision thinking or thinking that is not accurate or not true, the kind of things that go on in here that impact how you feel and how you act. How do you brush your brain? How do you get that plaque off your brain? How do you floss your heart? How do you deal with the stuff, the unresolved issues I talked about earlier that settle in your heart? Resentment, anger, abandonment, fear, rejection. How do you polish your behavior, and what kinds of things do you do on a regular basis to keep you in a functional, positive state, a mental health state? Just like you take care of brushing your teeth, flossing your teeth, doing your hair, getting dressed, and everything else that you do for your physical hygiene. What's your regimen? What's your routine for your mental hygiene? So you talked about some earlier with the Daniela presented quite well in all of those interventions and strategies. But just know that as you're doing those things, that is you attending to your mental hygiene, your mental health. We all have mental health. It's just a matter of where are we on that continuum. And if we're not satisfied with where we are, what can you do? What resources can you engage to help move you somewhere else on the continuum?
I love that analogy. I'm gonna start using that.
Yay! Thank you. I think that's it.
Absolutely. Did anyone have any questions about the presentation or anything before we end?
No, I was just going to piggyback and say that's actually a good analogy. It's actually better than saying just say no. So it can be like a preventative like motto that you use instead of saying don't say, just say no. Before you even get to that point, what's causing your stress, what's causing your burden, and things like that. So that's something to think about.
Exactly. Thank you.
I agree. Yeah, thank you.
Yeah, I just want to make a comment. This is like the first time I've even heard the concept of mental hygiene.
Mental hygiene,
Like,
that's right.
Yeah.
like I never once thought like, yeah, I always taught, okay, you should take a shower, brush your teeth, floss, you know, all this other stuff. But never once did I think, how do I brush my brain? So like I know for this year, I try to set a goal for myself because I have been hard on myself recently. And I've been trying to journal every day, try to get my feelings out in some sort of way, try to express myself. So wow, I'm gonna start using that. I'm gonna floss my brain more often.
Hey, I love it. I love it.
Hi, this is Deborah Thompson. Can you hear me?
Hey, Deborah.
How are you? I enjoyed this thoroughly. Thank you so very much for inviting me, Dennis. I worked with Dennis at the Urban League, but I also worked with the NAACP, and I'm a part of his health committee. We also have a youth council and a, a college division. And I think that this type of presentation should be placed where they can get access to it. And I would like to help you do that. I loved the presentations. I think that it was very well outlined. And I like the mental hygiene because I kept thinking, okay, we know how to clean our bodies. We know how to do that. And then the last thing is to say, I think it's Think and Grow Rich by Napoleon Hill, who says that it takes about 5 to 10 positive thoughts to get rid of one negative thought. I see, who's that, Aubrey shaking her head. And so it takes us some time to get rid of the negatives. Come real easy for us. So we need to work on trying to make sure that we get them out of our brains. So thank you so much for inviting me. And like I said, I don't know who I contact, but I guess I'll get with Dennis and see if one of you or all of you could make a presentation at one of our health committee meetings this year. And because mental health is one of the things that we are really attacking. And that's why I put in that at Behavioral Health Center, Northwest Behavioral Health, because they do a very good job, but they're underfunded and they need some help. And, but all of the time volunteers are not the best person to get to a mental health situation unless they've been thoroughly trained. So we want to just make sure that we're doing things proper and in order. So thank you so very much for inviting me, Dennis, and I thoroughly enjoyed it.
Thank you for being with us, Deborah. And just to let you know, we have several more coming up. And if we should talk offline about partnering with the health committee. As you know, I serve on that committee and would be happy to work with you to bring the same audience together. I think it would be wonderful.
But they're not only pretty and handsome and all that stuff, but they are, I mean, it was just very well organized and easy to understand. And I think that that's something that you can get to a youth committee, like our youth group, to just kind of give them some information.
And also just wanted to point out, this will be later this evening, it will be on YouTube, available for viewing and or downloading. So keep that in mind for sharing purposes.
So yeah, thank you everyone for coming. We really appreciate all the kindness that you guys are showing us, and we did work really hard on this. So just let us know if definitely follow the YouTube and send it around, send the video around. That's one of the beauties of today's day and age, is that we can have this wonderful meeting and then also send it around afterwards. Definitely make sure to click the link in the chat about the follow-up options. We're going to be sending around a community toolkit that Daniela set up for us so beautifully, and to really just look into like self-perspective and just put things into perspective and stuff that you don't think about too much, like, do I do this, do I do that, and when is the step that I should reach out for help, when is, you know, quote unquote, everyone hates using this in psychology class, but normal versus not normal. So your normal is going to be different than mine. It's going to be different than everybody's, but it's really important to just acknowledge that for yourself and just check in with yourself, like Daniela said, through journaling or replacing one negative thought with 10 positive thoughts. I feel like that's a great idea to just, you know, on your fingers when a negative thought comes up, just think 10 positive thoughts and, you know, keep going. So definitely click the link that I sent, and then we'll be sending out the toolkit. And then we also have our links for our other mental health meetings. That's going to be later March and then April as well. So we're really excited for those with different topics. And just a huge thank you again to everyone who contributed to the PowerPoint, as well as everyone who attended. Does anyone have any closing statements?
I just wanted to say on behalf of the Urban League and the Center for Advocacy and Social Justice, thank you to the interns that put this together. Thank you to our guests, Richmond Wynn. And by the way, congratulations on your new position. One reason I didn't introduce you was because I didn't know for certain if you were using that moniker now, that title. So congratulations. And also, I wanted to thank Deborah for being here and sharing her expertise as well, and all those that participated. One last comment came from Vanessa Boyer on our Facebook feed, and she says she's going to make sure that her youth pastor gets this information. So anyway, thank you very much, all of you, and thank all of you in the audience for coming, and we look forward to having you. And be sure to share this with others, that we will have subsequent virtual town halls on this topic. I think is very, very important, particularly for the community we serve, very necessary. So thank you. And we wish all of you a wonderful evening and great rest of the week.
Bye, everyone.
Bye-bye.
Bye.
Bye.